All right, welcome back, everybody. This is our last speaker for today, and I want to introduce to you Mark Fisher, who is our own Advocacy Engagement Manager at the Muscular Dystrophy Association. In this role, Mark leads MDA's grassroots program and advocacy volunteer efforts. He works to empower advocates and connect them with key decision makers in order to advance public policies that improve the lives of the neuromuscular disease community. He previously served as the digital grassroots manager at the American Heart Association, and he was also a field organizer on a U.S. Senate campaign. Mark earned his master's of public policy from American University and is originally from Pittsburgh. So thanks, Mark, for being here. I think this topic is really, it really hits home for the group that we're speaking to today. You know, not only are they trying to transition their care, but taking care of themselves and becoming more of an advocate for their care. So I think this is perfect. So thanks for your time today.
Excellent. Thank you so much for having me. I'm thrilled to be here. Let me pull up my presentation. My name is Mark Fisher. I am the Advocacy Engagement Manager here at MDA. And I'm beyond excited to talk about becoming a self-advocate. And what I mean by that is having folks raise their voices, tell their stories to make change in their community, but also for them as well. And how you can join our advocacy program and advocate for yourself, but for the community at large. So I hope this will inspire you, and I hope you will join our network. And I want to say at the outset, it doesn't matter how old you are. I know we have a variety of ages on the call today. It doesn't matter if you're 15 or 16 or a little bit older than that. You can still be your own advocate, and you can still raise your voice. We have advocates that are wonderful, and they are at various ages. So this program is open to everyone. And also throughout the presentation, I'll be giving some examples and pointing out some of our wonderful advocates that we have with us. And the first one on the right there is Justin. He is one of our former ambassadors, but he is still one of our amazing rock star advocates. And that's a picture of him on Capitol Hill during our latest Hill Day in 2019. And he continues to participate with us. And he was actually, he was part of our first ever virtual Hill Day last year. So I'll be pointing some of our all-star advocates, and hopefully one of you will become one of them in the future. So today I'm going to talk about a little bit about what we advocate on, what are some of our priorities, then go into why we even do this, why is this important, then the role of the volunteer and what our advocates do for us and what they do for themselves, and then how you can help out now if you're inspired to, what can you do right now. And then throughout the time, I know there's a question and answer box, so if you want to put some questions in, we will have time at the end that I'll gladly answer them. So first, here's our advocacy agenda. That's just a funny, fancy way of saying what do we advocate on, what are some of our priorities. We have them bucketed into 3 groups. So the first one is access to care and therapies from day one. And all that means is whenever someone is diagnosed with a neuromuscular condition, we want to make sure that they get the care and therapy they need immediately. And that's one of our big priorities we have there. And that's through the newborn screening program and early detection. That's through genetic testing and counseling. We also do a lot of work to make sure that folks have affordable and quality healthcare coverage that they can rely on. That's a big one of our advocacy priorities. And then one that we are working on is extremely relevant right now because of the COVID-19 pandemic is telehealth. Probably some of you on this call have done some telehealth visits lately. And a lot of them are made possible because the federal government made some they relaxed some temporary restrictions to make sure that telehealth can be available during the pandemic, and we're working to make those permanent so folks can take advantage of telehealth after this pandemic ends. The second category is accelerating therapeutic development. Again, that's a fancy word to make sure that we get therapies and drugs available quicker, but make sure that the clinical trials are robust and safe for the community who wants to participate in them. We do that by making sure that our advocates are in contact with the FDA and other agencies that work on therapeutic development. We also want to make sure that the clinical trials remain innovative and allow folks in the community to participate. And then this is something that is new because of COVID-19. We've done a lot of work this year, and that through help of our advocates is making sure that the COVID-19 vaccine is available for the neuromuscular community and those with high risk conditions. That's been a huge Huge undertaking. We contacted many states and many jurisdictions to make sure that those who have high-risk conditions can receive the vaccines if they choose as early as possible. And I'm happy to say, as of this week, every state and jurisdiction has made those with high-risk conditions eligible for the vaccine. Now, many of you probably, like myself, wishes this happened quicker, but we're there. We got there. And that was a direct result of our advocacy program and our volunteers' work. So that was a big win for us. And then my favorite section is empowerment and independence. We work to make sure that air travel is accessible. I know many of us might not think we're going to be traveling by air soon, but eventually we'll get back there. And we want to make sure that air travel is accessible when that day happens. We want to end workplace discrimination that we know those who are living with a disability still face. And we want to make sure that those who choose higher education can get it and it can be accessible for them. So those are our main buckets. Hopefully something in there might have perked your interest or something in there might speak to you. But those are the issues that we work on, that our advocates work on. So I want to take one quick step back and talk about why we even do this. Why does MDA even lead these advocacy efforts? I think some folks might be surprised that a nonprofit like ours gets involved in the legislative process. Some folks might think it's kind of sticky or maybe a little bit, they're just surprised we do that. And I always say that we do it because we have to do it if we want to live up to our mission statement. So we have MDA's mission statement on the screen there, and I really highlighted the word transforming. That's my favorite word in the sentence. And if we're really going to transform the lives of people who are affected by muscular dystrophy, ALS, and related neuromuscular diseases, we have to do advocacy. We can't transform the lives of our patients if they don't have access to the healthcare that they need. We can't transform the lives of people with neuromuscular conditions if we're not investing in medical research. We can't transform the lives of people affected by muscular dystrophy if we do not make air travel more accessible. And I can keep going and keep going and keep going. But for us to really truly live up to our mission statement and to really transform these lives, we have to do advocacy. And the only way we're going to be successful if we have volunteers like everyone on this call helping us. So that's why we do it. It's vital. And again, we could not live up to our own mission if we did not. So just want to talk about that real quick. So what are some things that all volunteers can do? What can they self-advocate on? And the good news is there literally is something for everybody. It doesn't matter what your comfort level is. There's something you can help with. There's something you can get involved with. And I have a few things here. First, the number one thing you can do is sign up to become an advocate. And I'll show you how to do that at the end of the presentation. If you sign up, you'll receive timely email updates. I promise you we respect your inbox. We know that email traffic is crazy, but we will email advocates from time to time, letting them know how they can raise their voice on issues that are important to them and how they can make a difference. One of the ways is asking folks to email or tweet their members of Congress. Members of Congress do want to hear from you. They want to hear from their constituents. They want to know what their constituents think. And we will ask our advocates from time to time to do that on issues that are important to them. We also ask advocates, and they're gladly helping us take action with government agency and their regulations. I think this is something that surprises folks, that we actually get involved and have our volunteers contact agencies like the Department of Transportation and the Food and Drug Administration and Health and Human Services. But a lot of decisions that those agencies make affect the community. Sometimes they can make decisions that affect the community more than members of Congress and their laws. It really can make a big difference. So because agencies have a big influence, we want to make sure they hear from us and they hear from our advocates. So from time to time, we will ask them to do that. We also put on educational webinars about once a month. We have our program that's called the MDA Advocacy Institute that we have every month, and we have a variety of topics that we educate advocates on. Anything from making sure that folks know their employment rights. We did a session on what are voting rights for people who are living with a disability. We've done them on the newborn screening program. We've done them on clinical trials. And this is going to be announced next week, but you're here, so I'll tell you now. We are doing one later this month on accessible air travel and the work we're doing to make sure that travel is accessible for everyone once we get back to more regular air travel. So we do them on a variety of topics, and folks who have signed up for our list get those notifications. And then finally, folks, we ask people to share their story online with us. This is the most powerful tool an advocate has in their toolbox, which is sharing their story. I can go to Capitol Hill every day. My colleague can go to Capitol Hill every day and advocate. But sometimes it takes that personal story that really connect with a lawmaker or a decision maker about why something they're considering would make a difference. And our volunteers excel at this. And I'll give you a couple examples, but sharing your story is the most powerful thing that anyone can do if they want to advocate for themselves. You're the expert in your story, and it really cuts through the noise. So those are some of the things we do online. We do a lot of online work. We did before the pandemic, and now during the pandemic, we continue to do a lot of online work. We also have folks do things for us offline. Before the pandemic, we had people visit members of Congress's office to have those one-on-one meetings. We had, again, a big lobby day in 2019 where we brought in a bunch of folks to DC to do that. But now we switched to virtual, but it's still just as effective. So we had our first ever virtual Hill Day in August, where we had people connect with their lawmakers on this same platform you're viewing me right now. And it was a big success, and I think we'll do that again this year. We have our grassroots volunteers call member of Congress's office. Sometimes picking up the phone does still make a difference, and we'll ask people to do that. We have advocates write blogs and other pieces for us. The example here is on your right. Ryan Coburn wrote a blog about his experience with an event we did when we connected him with the FDA. And then we have people organized in their community. So there's a lot of things that you can do to advocate for yourself and advocate for MDA. Again, it's a wide menu. Anything you're comfortable with, we can help you with. And I wanted to say that no matter what you choose, we will make sure you're prepared. So if you want to email your member of Congress, our system automatically matches you with your right lawmaker. So if you're not sure exactly who represents you, we'll make sure that we match you up correctly so you don't have to do that research. We can do that for you. If you're going to ever visit a member of Congress or do a virtual visit or pick up the phone, we will make sure you're prepared to do that. If you're giving us your time, we owe it to you to make sure you're prepared, to make sure you're as comfortable as possible. So no matter what thing on this list you would choose to do, we'll make sure you're prepared and make sure you're comfortable. So I want to return back to the power of your story. I just added this slide in this afternoon because I really thought it was powerful. Again, this is the most powerful tool you have in your toolbox is your story, and I just wanted to show two examples. The first on the left, this was a former intern of ours, a lovely man. His name is Josh, and he went to Capitol Hill last year at February of 2020, right before our world changed, and he went to Capitol Hill to advocate for himself. And that's a picture of him with his member of Congress and the staff behind him. And this picture still makes me smile to this day about probably the impact he had by going to his congressional office and telling his story. And I'm sure his member of Congress remembers him. On the right, this is Gabrielle Runyon. She participated in our first ever virtual Hill Day, which was in August. This is a photo of her, and she participated in our first ever virtual Hill Day. Where she met with her lawmakers face-to-face on the same platform you're viewing me right now. And she wrote a blog about her experience. So not only was she able to advocate, she was able to then present her experience and then write a blog about it that we've been promoting. So your story can make a difference. Again, doesn't matter what age you are, what your experience is, your story is powerful. So if we're going to ask folks to share their story, and ask them to advocate, we want to make sure it makes a difference. And I'll put this screen up to show you that we've had some great grassroots successes. Our advocates get things done. So I'll go through a few of them here. The first is newborn screening. We've seen a lot of progress, both federally and at the state level with the newborn screening program. There was a bill that was just reintroduced a few weeks ago that would reauthorize and strengthen the newborn screening program federally. So that was just recently a bill was introduced that we're advocating on. With COVID-19, there's been a lot of those emergency bills that have been passed. A lot of those help the neuromuscular disease community. made sure that they got the access they needed, the care they needed, and also they got the testing that they needed as well. So a lot of things there helped the community as well. And again, with the vaccines I talked about earlier, our work and our grassroots volunteers work to make sure they received access to the vaccine as soon as possible. Just last year, we passed a law with Advocates Help that would allow those who are diagnosed with ALS to receive their Social Security disability insurance benefits immediately um, and not have to wait 5 months like they had to before. That's been a campaign we've been working on for a few years, and it's great that that finally passed and folks who are diagnosed with ALS can get their benefits immediately. We've increased funding for medical research at the National Institute of Health for many years now, and that's a direct result of advocates pushing Congress to make sure that the NIH is funded. We made some progress on accessible travel. A bill that would make travel by air more accessible was just introduced this week or 2 weeks ago that would help improve air travel. So we are making progress there. Again, we had our virtual Hill Day that I spoke about earlier. And one of the bills we advocated for during that virtual Hill Day passed last year. So that's surprise medical billing. And that's been a huge problem that folks might go to the doctor, or especially with COVID-19, they might have to go to a new clinic because the other one they went to was closed because of COVID-19. And now all of a sudden they get a surprise medical bill because it was out of network and they didn't know that. Well, that process is done. And we ended surprise medical bills, and that which is a huge victory. And that was one of our big asks we made at the virtual Hill Day. So I just wanted to share that if we ask you to raise your voice and advocate, it will make a difference. And as you can see on the screen, we've had lots of successes because of grassroots advocates. I wanted to show this map of the newborn screening program. And newborn screening is one of those issues that we work on both federally and state. Most of our work is federal, but sometimes we have to do state by state work, and the newborn screening program is one of them. Each state runs their own program. So some states screen for certain neuromuscular conditions like SMA and Pompe, and some don't do anything. So we really have to work state by state, and this is just an example of that. If I would have showed you this map a year ago, it would have been a lot less colorful. We've made a lot of progress in just a year to make sure that states are screening for SMA and Pompe, and I am confident that we're going to see more states light up this year as well. I'm actively working with advocates in South Dakota and Virginia to improve the program in those states, just to give you an example of some of the state work we do. So I just wanted to show this to share that we are making progress, but sometimes it has to happen state by state. So with that, I really hope you'll join us. I hope you'll become an advocate and advocate for yourself, your community. If you do, there are two really easy ways to join us. The first is to go to mda.org/advocacy. That's mda.org/advocacy. And then on the left, you'll be brought up to a sign up form, and you sign up and then you're done. That's the easiest way to get involved, is to sign up there. You also can text us. You can text MDA USA to 50457. That's MDA USA to 50457. That's also a really easy way to join our network. We would love to have you, and we'd love to have more volunteers advocating for themselves, but also MDA. Now, if you're so inspired, you actually can take action now. Again, we are working to make air travel more accessible to the neuromuscular disease community. Again, as I said, a bill was just introduced a week or two ago that would do that. So we're asking members of Congress to sign up to support the bill. That's really important if we want to get it over the finish line. So if you want to email your members of Congress, it would make a big difference for us if you would do that. So the easiest way to do that is go to, again, mda.org/advocacy, click on our Action Center, which is the arrow pointing there, the pink arrow pointing there, and then you'll see the air travel campaign there, and you just click the Take Action button, and it'll walk you step by step. It's very, very simple. Again, that email could make a difference. So if you're so inclined, we would love to have you take action with us as well. So with that, that's the end of my presentation. I really want to take any questions anyone had. If you have any questions, feel free to email us at advocacy@mdausa.org. That's advocacy@mdausa.org. I read that box every day. I will respond personally to any email you have about anything. So with that, I will take any questions that might have come in.
Thank you, Mark. We did get a question come in our Q&A box. Any chance the airlines will allow us in power wheelchairs to fly on the plane in our own chair? Transfers are impossible, not to mention the damage that occurs with the chairs. We haven't been able to fly with our minor child SMA2 because of this, so she doesn't really get to go anywhere. Do you have any insight on that?
Yeah, I mean, it is a huge problem. There's just no doubt about that. We know that folks who have wheelchairs, they routinely get damaged and broken as they travel. We know it's a huge problem. I can't tell you when. I can't tell you how quick it's going to happen. It's one of our top empowerment issues is to make that more accessible. I mean, we are trying, there are a lot of reasons why some of the airlines don't want that to happen, and we're working with them to make it happen. I'm not going to say it's going to happen tomorrow, but it is a top priority to us to get air travel way more accessible for folks who have wheelchairs. You know, recently we had a small victory where American Airlines redid their weight policy about what they could carry on or what you could check. And because of that policy, anyone with a wheelchair basically couldn't fly because they were too heavy. And we contacted American Airlines and worked with a lot of other groups, and they reversed that policy. So that is a victory. I know that doesn't necessarily answer the question we just got, but what I will say is we're working with us and a lot of other organizations whose members have the same issue to change that. So it is top of our list. I'm not sure when it's going to happen, but we're working on it daily to make sure it does.
The sooner the better. Thanks.
Oh, I hear you. I hear you. I know. And MDA did a survey a couple years ago, and it was the #1 issue that folks in the community told us about was how air travel affects them. And it's the one of the #1 issues that we saw. And, we are working with a lot of other groups like the Paralyzed Veterans of America, the ALS Association, Cure SMA. I mean, it's a big coalition effort because we know if all these groups combine together and our volunteers combine together, we're a bigger voice. So we're trying.
I would suggest hopping on and emailing too, as
Yes.
well, you were talking about.
Yeah, the first step is to join our network. And when we have one of those actions available, we'll let you know. And, we are doing that, again, a webinar at the end of the month about accessible air travel. And I'm sure this will be brought up then. So I'd encourage people who are interested to join us and join that webinar. So.
All right. Thank you, Mark. I don't see anything else that has come up. And if you don't mind, if you could send me that information, that I could put that in our post-event email as well, the date of that webinar.
Sure. It is actually April 20th
at
3 p.m. Eastern. Again, people here are getting a sneak peek. Has not been, but it's April 20th at 3 p.m. Eastern. Yeah, I can send that to you.
Okay, perfect. Thank you, Mark.
Great. Thank you guys very much.